Hi everyone, happy Wednesday. Hope you're doing well and enjoying the beautiful blue skies outside. Today we're going to be talking about birth control, contraception, and pregnancy planning, and just the options that are available for folks who are looking to prevent pregnancy or looking to make sure that they aren't experiencing really horrific menstrual cramps and symptoms of their periods, or for folks who are trying to make their skin clearer by using birth control or other contraceptive options for making sure that your acne is taken care of. So gonna give a few seconds for my colleague to join in the space, and then we'll go ahead and get started into today's topic. All right, looks like Whitman-Walker's in the room. Just waiting for Instagram to catch up, and then we'll jump right into it. I gotta say that when I was looking through and reading through and learning about all of the contraceptive and birth control options, I just was like, wow, I have not been keeping up with everything available on the market. There are a lot of options. All right. Hey, Paul, I hope you're doing well. Thank you for joining. Cool. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. Today, we're going to discuss birth control, contraception, and pregnancy planning. But first, we're going to go over some review from last week and the week prior, just to keep that active recall going. So from our Masturbation for the Masses and Senses and Sensuality versus Sexuality lives, we learned that the safest type of sex that you can engage in is self-pleasure and masturbation. And when engaging in this type of sex, you're not at risk for swapping bodily fluid with another individual or contracting STIs or HIV or experiencing unplanned pregnancy. You also don't have to court anyone or swipe on any apps or spend money at a social event or bar to engage in this kind of sex or pleasure, so masturbation can be highly underrated and overlooked. We also learned that our senses can include some variation of touch, sight, sound, taste, and smell. Oxford Dictionaries defines sensuality as the condition of being pleasing or fulfilling to the senses. So this can be small things like watching a video clip or listening to a podcast or touching something soft and fuzzy. We also often hear that people use essentially sensuality and sexuality or sex interchangeably. So last week we also learned that, in turn, you can tap into a variation of your senses and engage in sensuality, and that can be enhancing to a sexual experience. The Victoria, Australia Department of Health defines sexuality as being about your sexual feelings, thoughts, attractions, and behaviors toward other people. You can find other people physically, sexually, or emotionally attractive, and all those things are part of your sexuality. And now on to pregnancy. So I don't think we can talk about birth control without reviewing how pregnancy happens. So pregnancy occurs when a sperm, this is a component or part of ejaculate, aka semen or aka cum, fertilizes an egg after it's released from the ovary during ovulation. The fertilized egg then travels down into the uterus where implantation can happen, and its successful implantation results in pregnancy. So key fact to take away here is that we use words like ejaculate or ejaculation and semen and cum interchangeably because they are, but part of what makes up that liquid or that fluid is sperm, and sperm is the actual little swimmers that are going to try and get people pregnant. They're going to try and seek out an egg to fertilize. So sperm is a part of ejaculate or semen or cum, but it's not the same thing as ejaculate or semen or cum. Now we can jump into learning about birth control options, and just heads up, we're going to go through a lot of options. I barely knew these all existed. I thought I had tried most of the options available. But essentially, if you're looking for birth control or something to help with your menstrual symptoms or acne, there's an option out there for you. If you're underinsured or uninsured, you can explore your local sexual health clinic, community health center, Planned Parenthood, or state's health department for free to more affordable birth control. And before we dive in, here's just a helpful tip about hormone replacement therapy and birth control safety. If you're going through hormone replacement therapy or HRT and are taking testosterone, you are likely still capable of getting pregnant, depending on the types of sex you're having and the partners you're having sex with. HRT and hormonal birth control can be safely used together. And if you haven't undergone bottom surgery yet and you are fertile, pregnancy is still an option for you. So just a heads up, if you are having sex with people with sperm and you are a person who has a uterus and are fertile, you can still get pregnant even if you are on hormone replacement therapy. Now we're going to jump into the types of contraception. So many options. So healthline.com shares that there are several types of contraception or ways to avoid unplanned pregnancy, and they all work a bit differently. So first up, you've got your life choices and your sex adjacent activities. This may mean that birth control is something that you and potentially your partners do to actively avoid an unwanted pregnancy. This method includes abstinence or not engaging in sex at all, outer course or sexual activities like oral sex or partner masturbation. And we're practicing fertility awareness to understand the times of the month that you are most likely not to get pregnant. So you can practice fertility awareness using the calendar method. This will help you predict when you're fertile by tracking your menstrual cycle and timeframes over several months. You can also use the temperature method. This helps you predict when you'll ovulate by tracking body temperature changes throughout your period. And finally, you can use the cervical mucus method, which helps you predict when you'll ovulate by tracking your cervical mucus or vaginal discharge or frontal discharge and the changes during your period. According to Planned Parenthood, fertility awareness methods are up to 76 to 88% effective. So this means that about 24 out of every 100 people using fertility awareness methods become pregnant. Using the fertility awareness method is a more ideal method for people who are actively trying to get pregnant or have a planned pregnancy. Next up, we've got barriers and non-hormonal contraceptive options. So a barrier method typically means that you use contraception as needed. This means that you or your partners are using something that goes in or onto the body before sex to block sperm from fertilizing an egg. The effectiveness of the barrier method differs based on whether people use these barriers correctly or as instructed. Fun fact, we often use them wrong to some extent, which decreases the effectiveness of the barrier or non-hormonal option. Some examples of barriers and non-hormonal options include the condom, the external condom, the regular condom, or also known as a rubber. It is anywhere from free to $2 each, and non-latex versions are available for people who have latex allergies, but the most common one you're going to come across is a latex condom. Condoms help prevent the transmission of STIs and HIV in pregnancy, so it's a really great option for both, preventing HIV, preventing sexually transmitted infections and preventing pregnancy. We also have the internal condom, or the FC2, or sometimes called the female condom. These run about $2 to $4 each. These are latex-free, hormone-free polyurethane pouches that can be inserted into the vagina or front hole, and they help prevent the transmission of STIs in pregnancy. Internal condoms can also be inserted into the vagina or front hole up to 8 hours prior to having sex. And just for anyone who hasn't seen one of these before, they kind of look like a regular condom. They're a bit wider in girth, and they have these rings at both ends, so it helps it kind of sit in the vagina or front hole, and then also kind of helps it, not get lost in there. You can also use FC2s or internal condoms for anal sex, but you have to remove the inner ring first for it to be effective and useful and safer. Next, we've got the sponge. This was a new one to me. This is $4 to $6 each, and the contraceptive sponge is a squishy, latex-free plastic disc that's saturated or covered in spermicide, aka sperm killer. You place it inside the vagina or front hole where it covers the cervix and blocks sperm from entering the uterus and killing them if they make any attempt to enter the uterus. You can put the sponge in up to 24 hours prior to having sex, and it can be used for multiple rounds of sex during that 24-hour window. Please note that you will need to leave the sponge in for at least 6 hours after sex, and it puts you at risk for toxic shock syndrome. Toxic shock syndrome is a rare life-threatening complication of certain bacterial infections. If you're a menstruator, you probably heard that term before. It was always kind of a beware note, if you will, like don't leave your tampon in for too long or for the above stated hours. Otherwise, you could be at risk for getting toxic shock syndrome, which again is a bacterial infection, and it can be deadly. So also, if you hate or you struggle with using tampons, this probably isn't going to be your favorite birth control option, but don't worry, there's so many more options that we're going to go over. Next up, we've got the cervical cap. This can be anywhere from free to $90 plus the cost of doctor's visits and spermicide. So a cervical cap is a reusable prescription silicone covering that you fill with spermicide and place over your cervix to prevent sperm from entering your uterus. Cervical caps can be left in for multiple acts of intercourse or sex and over a 48-hour period. They also have to be left in place for 4 hours after sex. Cervical caps require a prescription and must be replaced every 12 months. Next, we've got the diaphragm. This is free to $80 plus the cost of the doctor's visit and spermicide. This is a form of reusable prescription birth control. And a diaphragm is a soft silicone disc. You saturate or cover it with spermicide and then insert it into the vagina or front hole. There it will act like the cervix personal security or bodyguard and will help keep sperm out. It can also be left in for 24 hours of sexual activity as long as you add more spermicide to it every 6 hours. This isn't ideal to use if you engage in rougher, aggressive, or harder sex, as the diaphragm can be knocked out of place, or it's also a bad option if you're prone to UTIs. Finally, for this kind of category of birth control options, we've got spermicide. This is $6 to $18 per bottle or 60 cents to $3 per use. And this method can be used by itself, although it is needed for if you're using a cervical cap or if you're using diaphragms or sponges, it's used together. But spermicide can be used by itself. So you're basically going to squirt or insert the substance into your vagina or front hole before sex, and then during sex, the chemicals in the spermicide will kill sperm. Please note that spermicide is time sensitive, so it needs 10 to 15 minutes to dissolve before intercourse, and after an hour, you'll need to reapply more. So that was a lot. That was 6 different options. So just like effectiveness, so the internal condom or the FC2 or the female condom, if it's used perfectly, it's 95% effective at preventing pregnancy. Typically, since we are not perfect people and perfect human beings, when we do use it, it's usually only about 79% effective. For the external condom or the regular condom, with perfect use, it's about 97% effective at preventing pregnancy, but typically we use it incorrectly, and so it's only about 86% effective at preventing pregnancy. For the diaphragm, perfect use, 96% effective. Typical use, 88% effective. For the sponge, if you're using it perfectly, it's 91% effective. If you're using it typically, it's 80% effective. For the cervical cap, for people who have never given birth, it's about 86% effective. And for people who have given birth, it's about 71% effective. And for spermicide by itself on its own, when used alone, it's about 72% effective. Now, onto the hormonal on a schedule contraceptive options. So hormonal birth control methods are most often used on a regular basis. The levels of hormones differ based on the contraceptive. They may stop the ovaries from releasing eggs, thicken the mucus around the cervix, or thin the lining of the uterus. Hormonal birth control options include the pill, which is free to $50 per month, depending on your health insurance coverage, plus the cost of the initial doctor's visit. The pill combines estrogen and progestin to prevent ovaries from releasing eggs and in turn prevents pregnancy from taking place. The pill must be taken every single day at the same time to work. There's also a mini pill option that doesn't have estrogen, but instead just includes progestin. And because it doesn't contain estrogen, the mini pill is a good option for anyone who's breastfeeding, over 25 years old or less than 1 month postpartum, or who has had a bad reaction to the combination estrogen and progestin pill. People who use the pill or the mini pill report less severe period symptoms, and some people who use the mini pill have reported breast tenderness and acne flare-up. Personally, the pill is one of the options that I've used in the past. It was great, other than me and not being a perfect human being. I wasn't taking my pill at the same time every day. I was taking it more to help with severe period symptoms and cramps and things of that nature. So it was really great in that regard. But I do recall starting on a particular birth control pill and loving it, didn't have any side effects. It was really great. And then going to the doctor's office, and my doctor at the time was out of town, so I had to see his colleague. And so this doctor, I'm talking to him, I'm telling him like, oh, I just want to get back on this birth control pill I've already used and really liked. And he's telling me no, and that he's going to give me a new type of birth control. And I was like 17 or 18 at the time, just started going to the gynecologist. I didn't know any better to like advocate for myself and say, no, I'm going to get the one I've already had and like. So fast forward to getting this new pill, taking it for a couple of months. I think I got depressed for the first time in my life. I didn't even know what it felt like, but later on was like researching birth control options and pills and was like, oh, okay, this is probably why I've been in such a funk lately. And sure enough, I stopped taking it and I felt way better. And, next time I go to the doctor and I advocate for myself and get the pills that I liked and the pills that had, positively worked for me. So just a note to folks, you know your body best, and you have a right in the healthcare space to tell your doctor or your provider what you would like to do and not be subject to whatever they insist or think they can insist you do. Next up, we've got the shot, or Depo-Provera. This is free to $150 every 3 months. This is an injection of hormone progestin every 90 days in the doctor's office. No ovulation means no pregnancy. And so this shot will help prevent pregnancy by preventing ovulation from taking place. Many people who got the shot report that it lessens their menstrual flow and menstrual pain or stops their periods altogether. People have also reported nausea, headaches, dizziness, weight gain, and depression. And just also please note that if you end up wanting to get pregnant after being on the shot, the inability to conceive or get pregnant could last up to 12 months after your last dose. So just heads up, that's a long time to wait if you were really excited to get pregnant. So that might not be the best option if you are not planning out your pregnancy at least a year in advance. Next, we've got the ring. This can be free to $200 per ring per month, depending on your health insurance, plus the cost of the initial doctor's visit. This is a 2-inch wide plastic ring prescribed by a doctor containing estrogen or progesterone. And by stopping ovulation, the ring stops you from getting pregnant. So no ovulation equals no egg equals no pregnancy. You insert the ring yourself and leave it in for 3 weeks and then remove it for 1 week to have your period. Then you swap it out for a new one. So many people report that it reduces their menstrual flow, helps with acne, and makes their periods more regular. Breast tenderness and headaches are the most commonly reported side effects. But finally, please note you should be protected from pregnancy the week that you aren't wearing a ring, but pregnancy is a risk if you've had any slip-ups in your sexual encounters. I've also used the ring. I think it's a pretty great option for birth control. I switched from the pill to the ring at one point, and I thought it was great just because I didn't have to take a pill at the same time every day. I could set it and forget it for 3 weeks. And so it was a really great birth control tool and just helping with periods and cramps and stuff for me personally. So I'd highly recommend it. There's also the patch. This is free to $50 per month, depending on your health insurance coverage, plus the cost of the initial doctor's visit. This is a literal sticky patch that you stick onto your upper arm, or back, and it releases estrogen and progestin into the body. These hormones stop ovulation, which means pregnancy isn't possible. And so you apply a new patch every 3 weeks. You apply a new patch every week for 3 weeks, and then you use no patch for a week so you can have your period. Most people don't report any side effects from the patch, so it's another great option. Heads up, I was looking this up because I was curious, does this sticky patch come in multiple colors? Does it come in the flesh tones and whatnot? But it really just comes in a white color, like a very pale white, or maybe in a pale flesh white tone. So if that's the thing that matters to you, heads up on that. There's also the implant, and this can be free to $800 for implanting, depending on your health insurance coverage, plus around $300 for removal and the cost of the appointment. The implant is a plastic rod about the size of a matchstick, and it gets implanted under the skin where it releases the hormone progestin. This hormone blocks ovulation and therefore pregnancy. It lasts up to 3 years and can be removed at any time. Getting an implant doesn't require a pelvic exam, so if you're looking to avoid pelvic exams or haven't reached an age to start getting pelvic exams, this may be a great option for you. Getting the implant inserted into your arm requires local anesthesia and the use of a needle. So if you're not a big fan of needles, maybe consider another option. And you may be sore for a few days after the insertion, but that's kind of the end of the pain. Implants may disrupt periods and can cause minor side effects such as acne, breast tenderness, and weight gain. Next, we've got intrauterine devices, or IUDs. These are free to $1,300 depending on your health insurance coverage, plus the cost of initial doctor's visits and removal. Again, I know these prices can sound very alarming, but depending, again, if like you're underinsured or uninsured, you can always explore your local Planned Parenthood or sexual health clinic or Department of Health in your state, and they might be able to get you like free to affordable birth control options. So just heads up on that. But yes, IUDs are another kind of hormonal birth control. There is one of them that is not hormonal, but we'll go over that in a little bit. IUDs are T-shaped medical instruments that are inserted into the uterus by a doctor. They release a small amount of progestin, and this intercepts ovulation and therefore makes pregnancy impossible. They can stay in place for 3 to 7 years at a time. And during the hormonal IUD procedure, when they insert it into your body, it's normal to experience cramping, dizziness, fainting, or a slower heart rate. The hormonal IUD can make you stop having periods or make them much lighter or irregular. You might also experience side effects like spotting or cramping after getting a hormonal IUD, and this should go away in about 3 to 6 months after getting your IUD inserted. If you decide you want to get pregnant, you can take the IUD out and start trying immediately after. I've had the IUD before. I loved it. I had it for about 4 years. Like just took it out pretty recently, and it was a really wonderful break from periods. I was a big fan. And so that there's the one non-hormonal IUD that I mentioned. This is the copper IUD. The copper IUD works by deterring sperm. Sperm don't like copper, so as soon as they run into it, they turn right around and swim in the opposite direction. This keeps sperm away from meeting up with the eggs or fertilizing. So if the sperm can't get to an egg, pregnancy can't happen. And copper IUDs also must be inserted by a doctor. They can last for up to 12 years, very long time, but also like wonderful set it and forget it birth control options. And side effects include random spotting during early use, more cramps during your period, and heavier menstrual flows. Heads up, this wasn't my forte for IUD wants and desires, but it can be for some folks. And some people experience discomfort, including cramps during or after the insertion process, but you can take ibuprofen to help with the short-lived pain. And it's a very unique kind of pain if you haven't given childbirth before. That was kind of the first time that my body recognized like where babies come from on terms of a pain level. So just heads up on that, but it's very quick, not painless, but you'll survive it just fine. And then in terms of the effectiveness of all of these hormonal birth control options, the shot with perfect use, with perfect use, it's 99% effective. With typical use, it's 94% effective. The ring with perfect use is 99% effective. With typical use, it's 91% effective. The patch with perfect use is 99% effective, and typical use is 91% effective as well. And then the combination progesterone and estrogen birth control pill, it's 99% effective, and with typical use, it's about 91% effective. The mini pill, which just has let me double check before I say it. The mini pill, which just has the progestin in it, with perfect use is 99% effective, and with typical use is about 93% effective. So hormonal birth control is just like really up there in the 90s all the time for helping prevent pregnancy or unplanned pregnancy. Next, we have our more permanent options and our medical related options. So medical procedures like vasectomies or tubal ligation change the body and ultimately prevent it from fertilizing or getting pregnant. Tubal ligation can be free to $6,000 depending on your health insurance coverage, plus the cost of the doctor's visit. This is a procedure that people with fallopian tubes can get. Tubal ligation involves blocking, tying, or cutting the fallopian tubes. These tubes transport the egg from the ovaries to the uterus. And when the egg cannot reach the uterus, pregnancy can't happen. Tubal ligation is a permanent birth control method, and there's a very small chance that you may be able to reverse the procedure or get pregnant via in vitro fertilization afterwards, but there's no guarantee. Tubal ligation requires surgery and a 1 to 3 week recovery time and does not completely stop your period. Vasectomies, however, are free to $1,000 depending on your health insurance coverage, plus the cost of the doctor's visit. For people with testicles, a vasectomy is an outpatient surgery that involves blocking or cutting the tubes that carry sperm from the testicles to the penis. This keeps sperm from being added to ejaculate or semen or ejaculate or semen or cum, so no sperm equals no pregnancy. A vasectomy can be reversed, but it's considered a permanent birth control solution. And after a vasectomy, the doctor has to verify that no sperm is being able to pass into ejaculate. So for the first 3 months after a vasectomy, you'll need to use other birth control options, but other than that, they're a really great option. Vasectomies require outpatient surgery as well. local anesthesia and have a recovery time of 8 to 9 days. And we're going to have a future live where we talk more in depth about tubal ligation versus vasectomy, because I think there is a lot of onus put on people with fallopian tubes and uteruses to get tubal ligations before there's onus put on people with testicles and penises to get vasectomies. But one of these two options definitely has a shorter recovery time, a less invasive procedure, and just it's cheaper, it's safer, it's reversible. It's got a lot of benefits that outweigh the other surgery. And then finally, we've got the tried and true pull-out method. If you're looking to get pregnant, the best preventative option you can use is the pull-out method. If you're not looking to get pregnant, the worst preventative option you can use is the pull-out method. So the pull-out method has a perfect use failure rate of 4%. This means that when done perfectly, the pull-out method prevents pregnancy 96% of the time. A perfect pull-out means that the sex partner with the penis pulls out of the vagina or front hole when they feel they're about to ejaculate and offload away from their partner's genitals. Timing can be hard to control, and this doesn't take pre-ejaculate or pre-cum into account. Pre-cum and pre-ejaculate can have sperm in it and get a person pregnant. So the perfect pullout also involves taking precautions before having sex. Again, you have to make sure the penis is totally free and clear of any residual semen, and the person needs to urinate and clean off the tip of their penis before going in for another round of sex. Now, given that nobody is perfect, it's estimated that 18 to 28% of couples using the pullout method will get pregnant within the first year. That's largely because it's hard to pull off a perfect pullout method. And for folks who aren't in couples, for the singles people, like, this means that you can get pregnant within the first year if you're engaging in sex and using the pullout method as your only form of contraception or your only form of birth control. Now, if you think you may be at risk of getting pregnant because sperm got to your cervix, you can seek out Plan B or similar emergency contraceptive options, but you have to do so within 72 hours of having sex or that risk of exposure to sperm. If you've passed the 72-hour mark, you can still take ulipristal acetate, which is sold under the brand name Ella. It can be taken up to 5 days after sexual activity. The only catch is that you'll need a prescription to get it, and you can get the prescription from your healthcare provider, family planning clinics, urgent care centers, or your campus and student health centers. Now, a lot of folks do look to birth control to manage certain symptoms. So if you're concerned about managing any symptoms, depending on the symptom, there's going to be a birth control for that. So if you want to treat hormonal acne, you can best rely on combination birth control pills. If you want to treat gender dysphoria, the implant might be a really good option for you. If you're looking to treat heavy periods, hormonal IUDs might be a great option for you. If you're looking to treat polycystic ovary syndrome or PCOS, combination birth control pills might be a great option. And if you're looking to relieve yourself of period cramps or menstrual cramps that are just too aggressive, either the ring, the patch, or the combination birth control pill are great options for you. That's everything. I know it was a lot, but hopefully it was super informative. And I just want to say thank you for learning a little bit more about birth control and contraception and pregnancy planning. And good luck if you're exploring any of these options for your own personal health and well-being. You've got options, and that's a beautiful thing. Before we go, we want to give you a few reminders about COVID-19 and the vaccine. If you've already gotten your vaccine, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. Multiple variants are always spreading all the time, so it's understandable if you want to keep wearing your mask, depending on where you are. You know, the vaccine is not 100% effective and at preventing. It's not 100% effective at preventing new cases of COVID-19, but it is very effective at keeping people from getting sick from COVID, from being hospitalized with COVID, and from dying from COVID. So thank you for doing your part to help keep your loved ones in your community and yourself healthy if you've already been vaccinated. If you haven't been vaccinated yet and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. You can give us a call at 202-207-2480 to make a COVID-19 vaccine appointment. If you're having trouble making an appointment with us, or you're not near us, or just aren't nearby, and you're a DC resident, you can find information about COVID-19 vaccines at vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can learn more about the vaccine distribution processes there by visiting vaccinated.virginia.gov or calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but be mindful of masks and keep your distance whenever you are, out and about and don't know people's vaccine statuses and whether they've been vaccinated. Please remember to follow our Whitman-Walker family on Facebook, Instagram, and Twitter at Whitman-Walker, and check our website www.whitman-walker.org for the latest information on our services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439 and follow our fellow programs at RealTalkDC _ and at NoFilterDC. Thank you all so much and have a wonderful rest of your evening.